This is Dr. Someshwar from Shield Healthcare. I hope everyone doing good. And I welcome you all on to the Menopause series by Dr. Payal Bhargava, a co-founder of DivineMagic Foundation. Before starting the talk, let me take privilege to introduce Dr. Payal Bhargava ma'am, who is a postgraduate diploma in ART from and reproductive medicine from KL, Germany. And she did her fellowship in infertility from IMA Hyderabad, and she is a life member of IMA Menopause Society India and PCOS Society India. She is a member of Managing Committee of PCOS Society India and co-founder and director on board XPS Analytics Private Limited, and consultant at Sri Krishna Diagnostic Center and also consultant at Pranada Hospital, Hyderabad. And she is a co-founder for DivineMagic Foundation, a public health and awareness initiative working at grassroots level and digitally through its YouTube channel. Now, without much further ado, let me turn over the time to Dr. Payal Bhargava to take over the session.
Good evening, everyone. I welcome you all to this series of webinar on sailing through menopause. It is an awareness program organized by DivineMagic Foundation and Shield Connect. As we go through our presentation, you'll come to know why menopause is important for all of us, and it is essential for us to address it. So welcome to our first topic on series of sailing through menopause. As stated, an awareness series on menopause by DivineMagic Foundation and Shield Connect. So our first topic is the menopause experience, a woman's perspective. So in this, as we go through the slides, we'll come to know what menopause is, why we need to address it, and what are the problems women face during menopause. Women are the backbone of families throughout the world. In all countries and culture, they play a vital and critical role in their families. The expression sandwich generation has come into common parlance to describe those people who care for their aging parents while supporting their near adult children. And menopause sandwiches the woman of this generation further. We all know women as a mother, as a sister, as a daughter. They are extremely caring and put forth their caring nature above all. So they are called the silent sufferers. Life expectancy in India has improved marginally. India has seen an improvement in overall life expectancy at birth to 69 years, with women expected to live for 70.4 years and men for 67.8 years, according to the latest sample registration survey. With increase in life expectancy, why are we not addressing it? What about the quality of life? So as women age, as our mothers age, it is our duty now to take care of them and make sure that they don't suffer. The prevalence of menopause in India is, according to the census 2016, around 120 million women will be more than 45 years of age. And that is a huge, huge number we are catering to. So there's huge scope for perimenopause and postmenopausal women. Menopause in our country occurs between the ages of 45 and 50 years. The average age being 46.2 years in India as compared to 51 years in the Western countries. So we land up in early menopause. So why menopause is so significant, and why are we discussing it today, and why DivineMagic Foundation is taking this awareness program to all people so that we are able to take care of our women better. Now, the age of menopause and life expectancy, as described, the lifespan of a woman has increased from 23 years in the Roman era to 65 years in India and 80 years in the West. So almost 1/3 of women's life is spent after menopause. So what is menopause and why it has not been given importance when we were young and our grandmothers and great-grandmothers suffered from it, and we never knew what it is all about, and it was taken as life as it comes, and it was accepted as an old age suffering that a woman goes through. So it is a transition time like any other chapter in our life. Menopause is a normal natural event defined as the final menstrual period confirmed after 1 year of no menstrual bleeding. It represents the permanent cessation of menses resulting from loss of ovarian follicular function, usually due to aging. So menopause is when you don't have periods for 1 full year. So why does menopause happen? It can happen naturally, it can be surgical, and there's something called as premature menopause. Now, as you age, the reproductive cycle begins to slow down and prepares to stop. This cycle has been continuously functioning since puberty. As the woman ages and nears menopause, the ovaries make less of hormone called estrogen. When this decrease occurs, your menstrual cycle or the period starts to change. It can become irregular and then stop completely. The transition to menopause is called perimenopause. That is just before menopause, when your cycles start becoming irregular or you get periods just once in 3 to 4 months, and then finally one day you just don't get periods. It is typically characterized by shortening of the menstrual cycle, then by skip cycles. Perimenopause is the first stage in this process and can start 8 to 10 years before menopause. Postmenopause is the stage after menopause. Now, when we are born, as you can see in the screen, the eggs are reducing in number. So when we are born with certain number of eggs in our body. As we mature, the number of eggs start decreasing, and so does the estrogen hormone also. Now coming to surgical menopause, now if you undergo hysterectomy due to some reason and your uterus is not there, you will not get periods if the ovaries are also removed. So this leads to surgical menopause. This is sudden menopause, contrary to the natural menopause, which occurs gradually in your body. Coming to the early menopause, that is menopause setting before the age of 40, it is also known as primary ovarian insufficiency. So this early menopause really needs to be treated with hormones, as it will increase your suffering of the symptoms of menopause, and it leads to infertility also, as I had stated earlier that the eggs in the ovary, they start diminishing. So in early menopause, if it is before 40 years, you will lose your fertility, the chance of becoming a mother. So there are certain stages of menopause. As I stated earlier, there's perimenopause, menopause, and postmenopause. So menopause is when you don't have periods for 1 full year, but does your suffering or your symptoms starts immediately when you get menopause? No, it is not like that. The suffering and the symptoms of menopause start around 8 to 10 years earlier to achievement of menopause. This is very, very important. Why? Because there are certain lifestyle modifications, drugs, and other things which we can take to delay the suffering of menopause, or we may not suffer with them at all. So by around the age 35 to 45 years, estrogen levels will drop and your period will start becoming irregular. So the symptoms which you usually experience before menopause in the perimenopausal time is usually weight gain, night sweats, hot flushes, etc. Now, as estrogen levels keep dropping, your periods will stop completely. If you don't have periods for 1 year, it is called menopause. So here is a slide which is showing how natural decline of estrogen level occurs as we age. It is maximum at the age of around 30, 35, and then it starts dropping. As the estrogen levels start dropping in a woman's life, she has various symptoms of menopause. Now, due to this hormone deficiency, that is estrogen, a woman experiences irregular periods, hot flushes, she has difficulty in concentration, there's loss of libido, there's vaginal dryness, she feels very tired most of the time, she has night sweats, suddenly in the middle of the night, she feels very hot and gets up. There are mood swings, there's sleep disorders, and headaches. So the whole idea of doing this series is to improve the health-related quality of life of a woman. Now, do all women have menopausal symptoms? No. Some women don't experience it at all, and they carry on with their life without any difficulty. But yes, most of the women do suffer. So an asymptomatic menopausal transition probably does not affect the quality of life of a woman. The issues after menopause which may affect quality of life are, as stated, vasomotor symptoms, cognitive functioning, urinary complaints, mood swings, uterine bleeding, skeletal-muscular problems, sleep disorders, attractiveness, sexual activity, anxiety, depression, health-related quality of life associated with chronic conditions, health-related quality of life associated with medications given as she ages, and health-related quality of life associated with malignancy, particularly breast and genital cancers. So it is our prime duty to provide our women the best quality of life till the woman, as the woman ages and till the woman lives to the best of her ability. So aim is to age gracefully and peacefully. Quality of life is an important aspect to be considered at pre, post, and during menopause. So let's go a little deeper into the symptoms that a woman suffers while going through the menopause. So hallmark symptom of menopause is hot flushes. What is it? And how many women suffer through it? Around 75% of menopausal women go through hot flushes. What is it? The sudden sensation of extreme heat in the upper body that lasts for about 1 to 5 minutes, typically the neck, face, and chest. They occur several times per day, but can be as frequent as several times per hour. It may occur at night, leading to night sweats. It is associated with perspiration, flushing, clamminess, chills, anxiety, and at times palpitation. Now, most of the women are working at this age, which is around 35 and beyond. So it makes life difficult for them working in office or at home or managing other tasks. Coming to the next symptom, which is a genitourinary syndrome. What do we mean by this? It is common but very underrated symptom of menopause. Around 40 to 60% of postmenopausal women experience this, but only few come for the treatment. It is a very distressing symptom. It occurs mostly after menopause. They may be seen in women of any age who experience a high. It leads to significantly adverse effect on women's sexual health and quality of life. GSM is a progressive disease. It does not resolve spontaneously and it needs treatment. The other most common symptom of menopause is urinary incontinence. It affects almost 50% of women who are going through menopause. Incontinence in postmenopausal women occurs more often than other diseases we know about, like diabetes, blood pressure, or depression. There are three types of incontinence. One is stress incontinence, where while woman coughs, she may pass urine. there's overflow incontinence, and there's urge incontinence or overactive bladder, in which she may need the feel to rush to the toilet as soon as she has the sense of passing urine. The other is sleep disorders. A substantial number of women experience sleep difficulty in the approach to menopause. Sleep disturbances are very, very common at this age. Almost 60% of postmenopausal women suffer from sleep disorders during menopause. It affects the sexual health of a woman also. Decreased ovarian function and reduced estrogen production are associated with urogenital atrophic changes and related sexual dysfunction. Indian women hesitate to talk about sex and may present with depression or somatic symptoms. When asked in detail about other related problems they have, they come up with this disorder too. The most important disorder that the women suffer during menopause is osteoporosis. At the age of 25, our bones grow. And after a certain age, again due to deficiency of osteoporosis, they start becoming weak. The bone formation is continuous in our body, but after a certain age, the bone is destroyed more and is formed less, which leads to weakness of the bones. In our homes, we have always seen older women who just bend down and walk, and sometimes they have fracture also. Even mild injuries and mild falls lead to fracture in older women. This is a very preventable condition, and if taken care of at early ages of life and throughout as the woman ages, the falls and the fractures can be prevented in these women. Another very common and distressing disease is heart disease in menopause. Heart disease is a top killer of women, and a woman's risk for heart disease increases dramatically around the time she goes through menopause, and typically between ages 50 and 54. So as we see, menopause needs to be addressed and treated and caught early, and the woman should be brought to doctor for the treatment as soon as the symptoms start. So the most important thing is don't suffer silently. Stay in touch with your doctor. There is treatment available for all your symptoms. Get yearly checkup done. Menopause and aging, all those, if the woman is symptomatic or asymptomatic, can be prevented. So with this, I end today's lecture, and we'll come for the next one on menopause and body composition. It is important for us to understand how a woman's bodies undergo changes during menopause. As we understand these topics, we'll come up to the next thing as how to treat and what to do for our women. Thank you for your patient hearing.